Okay, welcome guys. It is Friday at 4:45, and that means Facebook Live Friday. My name is Dr. Theodore Sees with Rockford Family Eye Care. Today's topic is going to be about scleral lenses. Now, most people do not know what scleral lenses are. Scleral lenses are a large diameter lens. It's a hard lens that you wear that not only helps correct for vision, but it also can correct for certain eye diseases. There's many reasons why somebody might wear a scleral lens. Like I said, some of the eye diseases that occur, a couple of them are keratoconus, pellucid marginal dystrophy or degeneration, cornea transplants. Some people, the front part of the eye is so irregular that a pair of soft contact lenses or glasses will not give clear vision. So a scleral lens comes into, it's just necessary for them to be able to see clearly. Another thing that some people wear scleral lenses for are dry eyes. Some people who have significant ocular surface disease or dry eyes will cause their eyes to be so disrupted that nothing that they wear is going to be comfortable. So the scleral lens, and I'll explain why in a little bit, gives them great relief but also gives them really good vision. So this is kind of what a scleral lens is. It's kind of easier to kind of show a picture of what a scleral lens is versus having to kind of explain it. So what a scleral lens does is it is a hard lens, it's a really large lens that vaults the cornea. So this is the actual scleral lens, and then this is the cornea. Now this is a cornea of an irregular shaped cornea, probably due to some sort of eye disease. Most of the times it's called keratoconus that the eye disease is. And what it does is, keratoconus is where the front part of the eye, the cornea, where a normal soft contact lens sits, it starts to warp and it starts to become irregular. And so wearing a soft contact lens on top of a keratoconic eye will only fit that warp or mask it kind of like a glove, so you're not getting clear vision. So what a scleral lens does is this hard lens vaults the cornea, and it's filled with a fluid, a preservative-free fluid. That preservative-free fluid is what creates, plus the scleral lens, is what creates that brand new cornea. It's like there's no issues whatsoever with the cornea. Now, once they take the actual scleral lens out, yes, they still have that irregular shaped cornea or the front part of the eye, but when they wear that scleral lens, it gives the ability to be able to see 20/20, whereas in many cases, the best they can get is 2200 or even worse. People who have certain sort of corneal transplants, the ability to see clear, even though yes, they can see better than without that actual transplant, can be really, really insufficient. So a scleral lens comes in and that helps it out significantly. Now this reservoir of tears is also what can help people who have really bad dry eyes, because people who have dry eyes, whatever the reason it is that they have dry eyes, whether it be ocular surface disease, inflammation, medications, whatever, that reservoir of tears is continuously bathes that sensitive part of your eye, which is your cornea, in a preservative-free solution, so it gives you nice comfort all day long, plus clear vision. Okay, so I wanted to show you what a picture of what a scleral lens looks like. Now, everybody knows what a soft contact lens looks like. These are two hard lenses, okay? There's multiple different sizes that hard lenses can come in, but a normal hard lens, or a regular RGP, a rigid gas permeable lens, is pretty small, as you can see. All right, that cornea, or that lens, just stays right on the cornea, whereas the scleral lens is significantly bigger, and it completely vaults the cornea. It actually lands on the white part of the eye, and you can kind of see that right there. It's sitting on the white part of the eye, and that's not the best fit, but that's where a scleral lens fits. It's on the white part of the eye, okay? So scleral lenses are a great option for some people who have certain eye diseases, who have certain conditions where they just can't see well with a soft contact lens or a pair of glasses. They're definitely not for everybody. They're more of a specialty fit, but that is one of the things that we do here for certain eye diseases with our patients at Rockford Family Eye Care. I wanted to give a big shout out to Art Optical, because we use their Ample Eye. They have an amazing scleral lens that we've had huge success with, and it's just made where it can fit a lot easier. We find that the comfort is good and the fit is just great. And we've had a lot of success with a lot of our patients on that. I just had a patient about a month ago in. He's a 14-year-old boy. He has keratoconus. Best corrected vision with glasses was about 200. Now he's 20/20. Now, to have that is life-changing. When you can't even see the board when you're at school, it's pretty debilitating. But with Scleral Lenses, he was 20/20. There's all different types of companies that make scleral lenses. We've just had a lot of success with Art Optical and their Ample-Eye, and so that's what we've kind of stuck with. So that's all about sclerals. The quiz question of the day is, I want you to, first person to name one eye disease that sclerals help for, okay? If you can name one of the diseases that I listed earlier, first person who names that or posts it below will win a $5 Big B gift card. And that's all about sclerals. I will see you next week at 4:45 on Friday.